There is a story I will never forget. It happened on a cold autumn morning in Cleveland, where I've worked for nearly 4 decades. A 71-year-old man was rushed into the emergency room. He couldn't speak clearly. The left side of his body suddenly weakened, and his eyes were filled with fear. Every sign pointed to a stroke, but what made me pause for a few seconds wasn't his condition. It was his hands trembling softly, his nails pale and washed out, with a thin black streak running along his thumbnail. And in that moment, I realized his body had been trying to warn him for a very long time. What saddens me is that most Americans have no idea that the fingernails reveal early signs of circulation problems, oxygen decline, and vascular inflammation. The 3 core drivers of stroke. We pay attention to blood pressure, cholesterol, heart rate, yet ignore the one thing we see every day but never learn to understand. Our nails, the shocking truth few Americans know. After more than 40 years in medicine, I've learned one undeniable fact. Most of my stroke patients had nail warning signs 3 to 12 months before the stroke occurred. The only thing they lacked was awareness. A study from the American Heart Association found 40–60% of microcirculation problems show up in the nails before they appear in the heart or brain. Yet no one ever teaches us that. Pale nails can signal reduced oxygen to the brain. Deep vertical ridges are footprints of chronic inflammation, one of the biggest drivers of arterial narrowing in older Americans. Blue or purple nails warn of failing circulation. Slowed nail growth reflects a brain not receiving adequate nourishment. Black streaks or downward curving nails can be signs of imminent stroke risk. We live in a culture focused on appearance, but we treat nails as cosmetic, not clinical. And because of that, millions of people miss one of the strongest warnings their body will ever send. If your nails could talk, what would they say? Imagine this. Each morning you brush your teeth, wash your face, make a cup of coffee, check the mailbox. Yet you rarely spend even 5 seconds looking closely at your nails. But those 5 seconds could save your life from a stroke. I'm not exaggerating. I've seen this play out too many times in my career. If you know how to read them, your nails become a micro map of your blood quality, oxygen delivery, inflammatory load, and overall cardiovascular and brain health. They're a built-in early warning system, free, accessible, and requiring no machines or lab tests. Why does the body send warning signals through the nails before a stroke happens? The answer lies in microcirculation. Your fingernails sit at the farthest point from your heart. They are the first place to react when arteries begin to narrow, blood thickens, oxygen drops, inflammation rises, or tiny microclots begin to form. These problems often develop silently over months. You don't feel headaches, you don't feel dizziness, you don't feel weakness, but your nails notice everything. They change color, growth rate, shine, and texture, quietly mirroring what's happening inside your blood vessels. The hardest truth I've learned is this: strokes rarely come out of nowhere. The body always sends warnings. We simply never learned how to listen. Why Americans are missing their chance to protect themselves. In today's fast-paced American lifestyle, quick meals, poor sleep, chronic stress, unbalanced nutrition, low omega-3 intake, high inflammation levels, the body is constantly sending signals through the nails. But because we lack the knowledge, those signals become lost messages, and by the time the brain finally speaks through a numb arm, a drooping smile, or a morning when words can't form, it's already too late. What this video will give you. In this video, Dr. Ethan Greenwell, specialist in health and aging, will help you decode every one of those signals. You will learn how to read the smallest nail changes to understand what your body is lacking, whether your arteries are narrowing, whether your brain is receiving enough oxygen, and most importantly, how high your stroke risk truly is. This is not scary knowledge. This is empowering knowledge. Knowledge that gives you back control over your health and your future. So let us begin this journey together. A journey that might not only enlighten you, but may very well save your life. If there were one thing I wish every one of my patients understood, it's this. It doesn't strike in a random moment. It doesn't fall from the sky like some kind of curse. A stroke always knocks before it comes in. The trouble is, most of us never hear that knock. And strangely enough, the very first knock doesn't come from the brain or the heart. It comes from something tiny, quiet, sitting right at the tips of your fingers. Your nails. I remember a cold winter morning a few years ago. A woman named Margaret, 67 years old, walked into my clinic. She laughed. She chatted. She said she'd just been a little tired, a bit forgetful lately. Nothing serious, she told me. It's probably age, Dr. Ethan. But when she reached out her hand for a blood pressure check, I saw her nails, pale, slightly scooped in, and a faint purplish streak along the edge. I asked her how long that change had been there. She shrugged. Oh, a few months. But who pays attention to nails? Right. I looked at her and said slowly, Margaret, sometimes our nails know something is wrong long before we do. 1 week later, she was diagnosed with severe anemia, vasculitis, and a 40% carotid artery narrowing. Luckily, she came in early. Luckily, her nails spoke in time. You know, I've been doing this work for over 40 years, and the older I get, the more I realize a truth that feels both comforting and haunting. The body is always talking to us. We just rarely listen. Nails are a perfect example. They can't speak, they can't shout. Hey, a stroke is coming, but they change color. They change growth rate. They change texture. Tiny changes, subtle shifts, yet astonishingly accurate signals. And the question I want you to think about is this. How many signs has your body given you that you ignored simply because you thought they were not important? How many times have you looked at your nails without actually looking? How many times have they looked paler, more brittle, more ridged? And you just told yourself, it's age. How many of us ignore our bodies until our bodies no longer have the strength to say anything at all? I've seen patients whose lives would have been completely different if they'd come to me just a month earlier, sometimes a week earlier. But I've also seen people who avoided a major stroke simply because they noticed something strange in their nails. A tiny change, saving a very big part of their life. The point is, your nails aren't cosmetic. They're windows into your bloodstream, your oxygen levels, the health of your vessels, even the inflammation quietly building itself. In the next video, we're going to do something important. We're going to understand why nails are the earliest messengers of blood vessel and brain health. If you've ever wondered, why can something so small at my fingertips warn me about something so big in my brain? Stay with me. Because once you understand the mechanism behind it, you'll never look at your hands the same way again. Why nails know first. If you've ever questioned why tiny nail changes can predict something major inside your body, let me tell you a story. A few years ago, I met a man named Robert. He was 63, a former soldier, disciplined, strong, the type who always said, I'm fine, I'm healthy. He came in because he felt slow and a little lightheaded sometimes. Not much, just a few seconds each time. Probably age, he said, but when he took off his watch and held out his hand for a pulse check, I saw something else. His nails looked grayish. Not blue, not white, just a dull, dusty kind of gray. And the interesting part, those nail changes appeared before he ever felt the dizziness. Robert didn't believe it. How can my nails know something before my brain does? A wonderful question. Why do nails warn first? The answer is simple, and honestly, quite beautiful in this way nature works. Your nails are the farthest point from your heart. Blood has to travel a long, narrow, winding road to get there. So when blood flow weakens, when oxygen drops, when inflammation silently irritates the vessel walls, the farthest places feel it first. Just like a plant when water runs low. The leaves at the tips wilt first, not the stem. Your nails are the leaf tips of your body. They see the changes in blood, in vessels, in oxygen, long before your brain realizes anything is wrong. Your brain is selfish. It protects itself, first takes the oxygen, takes the blood, takes priority. Your nails, they get what's left. So when the leftover circulation starts becoming unstable, your nails tell the story first. Medicine calls this tiny blood vessel system microcirculation. Thousands of little pathways, thinner than a hair, and even the slightest change, thicker blood, less oxygen, inflamed vessel walls, makes your nails react. You can't feel these changes, but your nails can record them through color, growth speed, shine, ridges, curvature, strength. They're like a slow, quiet diary. Honest, precise, patient. I once met another patient, Helen, 72 years old. She came in for, believe it or not, insomnia. Nothing more. But when she placed her hands on the table, I noticed her nails were thicker than usual, slightly curved, with uneven white edges. From her nails alone, I ordered tests, and just as I suspected, she had chronic low oxygen from undiagnosed lung disease. Left untreated, it could have led to heart failure. I refused and asked, how did you know? I felt perfectly fine. I told her, you didn't feel it. But your body did. Your nails were just doing their job, sending signals. When was the last time you really looked at your nails? Not to clip them, not to file them, but to ask your body, are you okay? Is my blood flowing the way it should? The truth is, just a few seconds of observation every day can detect problems long before dangerous symptoms start. The lesson I want you to take from this part is, don't wait until your body cries for help. Listen when it whispers. And to understand those whispers clearly, let's start with the most common and most ignored warning sign: pale nails, the loss of natural, healthy pink color. In the next section, I'll help you understand why nail color can reveal hidden problems in your blood, your oxygen levels, and your brain health, sometimes earlier than medical tests. Let's continue. There's something I always tell my older patients. The body is never silent. It simply speaks in ways we're not used to hearing. And among all the signals the body sends, there is one that's delicate, subtle, yet incredibly powerful: the color of your nails. Pale nails, nails that lose their natural color, are often the very first warning sign. Sadly, Americans ignore them. I think back to a patient named Carol. She was 70, cheerful, always smiling. She came in simply because she felt a bit more tired than usual, a little less focused. She thought she was just losing sleep or maybe stressed from babysitting her grandkids. But when she raised her hands to remove a ring that felt a bit tight, I noticed the color of her nails, so pale they were almost white, as if blood had never reached them. I asked her how long her nails had looked like that. She chuckled softly. "Oh, for a while now. Doctor, I thought nails just get lighter with age." No, that's not how it works. Pale nails are not a sign of aging. They are a reminder that blood life itself is not. Why are pale nails so dangerous? They need rich blood, clear, open blood vessels, and a steady flow from the heart, all the way to the fingertips. So when nails become pale, it often points to poor circulation, arterial narrowing, low blood oxygen, hidden anemia, or even early signs of heart failure. And here's what matters: that paleness appears long before the brain sends any dramatic signals like dizziness, weakness, or slurred speech. It's like the winter sky. It turns gray long before the snow falls. Nails gray out long before a stroke happens. Try this. Press gently on your nail until it turns white. Then release. If the pink returns within 1 second, normal. If it takes more than 2 seconds, your blood flow is slowing down. And that is never good news. Many people don't realize this tiny test is used in emergency rooms to assess circulation in critically ill patients. Yet you can do it at home, every day. How many times in your life have you looked at your nails and thought, "It looks a little pale, but I'm sure it's nothing. Maybe it's the lighting"? How many times have you noticed a change and ignored it because it didn't feel dramatic enough? We often overlook the gentle warnings until they become serious ones. The body rarely screams at the beginning. It starts with little taps, tiny changes in the nails that, if we listen, could help us heal much earlier. A small lesson from Carol. When I looked further, Carol wasn't just anemic. She had low oxygen levels at rest and signs of a 30% carotid artery narrowing. If she hadn't paid attention earlier, the story might have been very different a few months later. When she saw her results, she sat quietly for the long moment and said, "Doctor, I never imagined these old nails knew something before I did." And I told her the same thing. No part of your body is old if you know how to listen to it. If pale nails whisper circulation is weakening, then deep vertical ridges tell a different story. A story about chronic inflammation, one of the most dangerous forces behind strokes in Americans over 60. Let's keep going. Deep vertical ridges, the silent carvings of inflammation. There are signs the body gives that aren't cries for help, but etched lines, small and quiet, sharp as if time itself carved them into us. Those are deep vertical ridges on the nails. You know, whenever I see those ridges, I don't just see a surface change. I see a story of internal fatigue, a story of blood vessels slowly worn down by something we cannot see with the naked eye. Chronic inflammation. Let me tell you about Thomas, 74 years old. Calm, gentle, always wearing the same old baseball cap and a kind smile. He came because he sometimes felt food sticking in his throat and occasionally felt his mind slow down. When he placed his hands on the desk, what caught my attention wasn't trembling or sweating. It was the ridges running straight from the base to the tip of each nail, unusually deep. I asked how long they had been. He smiled. Oh, years. Doctor, I figured it's just aging. More years, more lines, right? Like rings in the trunk of an old tree. That's what we'd like to believe. But no, deep vertical ridges are not the history of aging. They are the history of inflammation. Why do they reflect chronic inflammation? Because forming a nail is a delicate process. Your body builds layer upon layer of keratin, rhythmically, precisely. But when chronic inflammation is present, vessels become irritated. Blood carries fewer nutrients. The nail matrix cells slow down, and the nail surface becomes uneven, ridged. Each ridge is a moment when the body couldn't maintain stability. A day of heightened inflammation, a week of poor diet, a month of prolonged stress, like a lake that ripples only when something disturbs it. Deep ridges tell a bigger story than research links them to diabetes, high blood pressure, high cholesterol, heart disease, arthritis, chronic stress, inflammatory diets. All of these contribute to arterial narrowing and increased stroke risk. That's why, when a patient suddenly develops deep ridges, I always ask, have you been more tired lately, sleeping less, eating irregularly? Because the nails often tell me something. Long before the patient realizes it, have you ever looked at your nails under the light and wondered, do these little lines mean anything? Or are they just part of getting older? Here's what I can tell you. Age does not carve ridges, but inflammation, lifestyle, and vascular health do. Age is simply the number of years we've lived. Our nails tell us the quality of those years. A lesson from Thomas. After testing, we found his CRP inflammation levels were high, his blood sugar elevated, and his carotid artery walls were thickening. Those ridges weren't harmless. They were honest entries in a health journal the body keeps, a journal no one had ever read. Nearly a year later, when he returned for a checkup, his nails were smoother, the ridges noticeably faded. He grinned and said, "Dr. Ethan, I never knew my nails were a health diary." And I told him, the body never lies. We just rarely let it finish its story. But ridges are not the only clue. When inflammation rises and oxygen falls, the body begins to paint the nails sometimes blue, sometimes milky white, sometimes a strange gray, and that leads us to our next topic. Color changes in nails, and why they're one of the clearest warnings that the brain is not getting enough oxygen. Let's continue. The interesting thing about nails is they don't know how to speak, but they do know how to change color. And very often, nail color is the most honest way your body delivers news to you. Over the years, I've seen just about every kind of color on my patients' nails. If there's one thing I've learned, it's this. When your nails change color, your body is trying to tell you a story you cannot afford to ignore. Let me tell you about Raymond, 69 years old. A gentleman, lived a simple life, loved fishing and his morning coffee. He walked into my clinic in seemingly perfect condition, except for one thing. His fingernails were bluish purple, as if his hands were freezing cold, even though it was a warm day. I noticed it for a while. "Doctor," he said, "probably just weak circulation, but blue-purple is not a little weak. Blue purple is your body's way of warning you it's not carrying enough oxygen. When blue or purple, it may mean the heart is not pumping effectively, the lungs are not exchanging oxygen well, or the tiny blood vessels are being squeezed by inflammation or narrowing." And what worried me most was this. His nails had changed color before he ever felt short of breath. Each color hides a different secret. Blue or purple nails, a sign of serious oxygen shortage. They're like a lighthouse flashing before a storm, even when the sky still looks calm. In Raymond's case, testing showed mild low blood oxygen and peripheral circulatory disorders, sooner or later, that would have affected his brain if we hadn't intervened. White nails, when blood can't reach where it needs to. I once met another patient, Linda, 73 years old. Her nails were so white, they looked almost like porcelain. White nails are often associated with severe anemia, microclots, tiny blood clots blocking microcirculation, reduced liver function, or long-standing low oxygen states. Linda told me her nails had been this white for years, but her tests showed extremely low hemoglobin and blood flow to the nails that was almost constantly running on low. Age doesn't make nails turn white. Anemia and poor circulation do. Purple nails. When blood arrives. Purple nails often occur when blood pools at the fingertips. Veins are not working efficiently. The heart is too weak to pump blood back up. It's like a river blocked. Water comes in, but it can't flow out. Gray or dull nails. The color of whole body exhaustion. In many cases, gray nails indicate Blood isn't delivering oxygen efficiently. Red blood cells are of poor quality, or the body is under long-term oxidative stress. To me, gray is the sunken color of exhaustion, not emotional exhaustion, but the exhaustion of your entire circulatory system. When you look at your nails, what do you see? Just a small surface, or a mirror reflecting the state of your heart, lungs, blood, and blood vessels. Have you ever asked yourself, is this nail color something my body wants me to pay attention to, or do you just glance past it? The way we often glance past important things that have become too familiar. Sometimes, the smallest changes carry the biggest messages. In all of these stories and hundreds of others I've seen, there is one common thread. The nails changed color before any major symptoms appeared. That is why I keep telling my patients, don't wait until your body screams. Listen when it starts to change color. Because once we know how to read these colors, we can prevent much worse things. The things that happen when the brain doesn't get enough oxygen or when blood vessels become blocked. But color isn't the only story. The body leaves behind another subtle signal, one that most Americans would never connect to the brain or the heart. The speed at which your nails grow. In the next part, we'll explore why slowing nail growth is an early sign that the brain is no longer receiving the nourishment and blood it needs to stay healthy. Let's move on. Nail growth. The rhythm of how well your brain is fed. There's something many people never consider. The speed of nail growth, something tiny, ordinary, almost invisible in daily life, can actually reveal how well your brain is being nourished. If nails are the little notes your body leaves behind, then their growth rate is the rhythm of health, the rhythm of circulation, the rhythm of life. I remember a patient named Martha, 71 years old. She had the gentle look of a retired school teacher and a kind, quiet smile. She said, "Dr. Ethan, lately I feel like my brain is slowing down. Not dementia, just harder to focus, but it's probably age." When I asked deeper questions, she said something that caught my attention. "My nails seem to grow very slowly. I used to cut them every 2 weeks. Now, even after a month, they hardly seem to grow. Most people would ignore that. I don't. Why is slow nail growth an important sign? Healthy nails typically grow about 2 to 3 millimeters a month. To do that, the body has to provide enough blood, enough oxygen, enough protein, enough minerals, and a microcirculation system that runs smoothly. But when circulation slows, when vessels stiffen, when oxygen levels drop, or when the brain starts taking priority on nutrients just to maintain itself, the nails are often the first ones to sense the shortage. Just like a city running low on power, the streetlights farthest from downtown go out first. When nail growth slows, it tells me this: your brain may also not be receiving the nutrients it needs. The brain and nails, an unlikely connection. Most people think nails and the brain have nothing in common, but they actually share something crucial. Both depend on nutrients delivered through the smallest blood vessels in the body. When these tiny vessels become narrow, inflamed, hardened, or blocked by microclots, then both the brain and nails become hungry in the same way. In the brain, you might feel slower thinking, mental fatigue, trouble concentrating, occasional mild forgetfulness. In the nail, it shows up as slower growth, weaker structure, easy breaks, dull, less shiny surfaces. 2 signals, 1 underlying problem. Martha's story. When I looked at tests for Martha, we found low protein levels, poor peripheral circulation, severely reduced vitamin B12, and early signs of small vessel narrowing. Not a catastrophic illness, not an emergency, but a clear picture of a body quietly undernourished, with the brain as one of the first organs to feel the impact. A few months later, after improving her diet, increasing protein, and boosting circulation, her nails began to grow faster again. At the same time, she told me her mind felt brighter and more excited. What I remember most is when she looked at her freshly cut nails and said, "It's strange. I never thought my nails could tell me what I'm missing." I smiled. Our bodies always know how to speak. Sometimes they just choose something very small to say something very big. Have you ever noticed whether your nails grow fast or slow? Have you realized you're trimming them less often than before, but simply thought, "I'm getting older, that's all"? Maybe that's true. But it could also be the moment your body is whispering, "I need better nourishment. I need better blood. I need better oxygen." Every time nail growth changes, your brain may be going through a similar change. When we look at how fast nails grow, what we're really looking at is circulatory health, nutrient delivery, microvascular strength, and the youthfulness of the blood feeding your brain. Slow-growing nails are not meaningless. They're a gentle invitation to care for yourself more deeply. And if growth rate is a subtle signal, then nail deformities, black streaks, clubbing, splitting are the real red flags. In the next part, we'll talk about the most dangerous signs. The signs that, when they appear, your body is trying to tell you something extremely important. Pay attention. Right now, let's keep going. Among all the signs our nails can show us, some are just gentle reminders, but others are like red flags snapping in a strong wind, warning that something serious is happening inside the body. And these three signs, black streaks, downward curving nails, and nails lifting off the nail bed are exactly those kinds of red flags. They don't show up to frighten us. They show up so we pause, listen, and take action. Black streaks under the nail. The mark of troubled blood flow. I remember a patient named Arthur, 66 years old. He was strong, still played golf every weekend. He came to see me because he noticed a thin black line under one of his nails, running from the base to the tip. He thought he'd slammed his finger in the car door or bumped it somewhere. The strange thing was, he couldn't feel any injury at all. That black line wasn't a bruise. It was a sign of tiny microclots. Blood clots so small you can't feel, but big enough to disrupt the blood flow feeding the nail. And if the tiny vessels in the fingertips can be blocked like that, just imagine what might be happening inside the small vessels. When we looked further, Arthur's carotid artery was already nearly 50% narrow. Downward curving nails clubbing when the body has lived in low oxygen for too long. Then there was Florence, 73 years old. She didn't come in because she was worried about her nails. She came because of a chronic cough and a kind of exhaustion she couldn't quite explain. But what caught my eye were her nails. They curved downward, almost like tiny upside-down spoons. This is a classic sign of chronic low oxygen, often seen in people with lung disease, heart disease, or long-standing circulation problems. The frightening thing is, nails don't curve like that overnight. It's the result of a long journey, years of the body trying to compensate for a lack of oxygen. Like an old tree growing in poor soil, it survives, but its shape changes over time. Our bodies are the same, nails lifting off the nail bed. When the nail leaves the place it belongs, nail separation, or onycholysis, is when the nail lifts away from the skin underneath. A white gap appears, as if the nail is pulling away from the hand. I once met a patient named Janet, 70 years old. Her nails slowly began separating over the course of several months. No pain, no swelling, no fungus, but beneath that, we found an underactive thyroid, weak circulation, and instability in her microvascular system. A nail separating from its bed is like a relationship losing its connection. Something inside has changed long before we consciously notice it. How long has it been since you really looked at your nails, actually? Not to trim them, not to paint them, but to ask your body, are we okay? Because these signs, black streaks, clubbing, nail separation are not cosmetic issues. They are stories, they are journals, they are imprints of time and inner health. And sometimes, they're warnings of things we never want to go through, like transient ischemic attacks, stroke, or heart failure. Our bodies are incredibly honest. They don't change the nails for no reason. Those black lines are not just color. Those curved nails are not just shape. Those separating nails are not just ugly. They are warning letters. And sometimes, they are the last opportunity we get to turn things around. But recognizing the signs is only the first step. What matters more is what we do once we've seen them. The 30-day nail-based stroke prevention protocol. You know, after more than 40 years in practice, I've realized that health doesn't change because of big decisions alone. It changes because of small habits, repeated quietly, day after day, the things we do when no one is watching. And the fascinating thing is, nails respond to these small changes faster than almost any other part of the body. That's why I believe that if you want to improve circulation, lower your stroke risk, and nourish your brain again, you can start with a 30-day journey I often share with my patients. I call it the 30-day nail-based stroke prevention protocol. It's not complicated. It doesn't require iron discipline, fancy equipment, or a gym membership. Just your presence and a willingness to listen to your body each day. Days 1-7. Hydration reset. Restarting the flow of life. Water doesn't just hydrate you, it thins the blood slightly. helps it move more easily, and carries oxygen to your nails and to your brain more efficiently. I had a patient named Dennis, 68 years old, who drank very little water for almost 20 years. His nails were dry, pale, and had fine horizontal cracks. Within just 2 weeks of increasing his daily water intake, his nails looked brighter, less brittle, and his mind felt noticeably lighter. In his own words, so my question to you is, have you really had enough water today? Or do you only drink when you're already thirsty? In this first week, start by drinking regularly, spacing it out through the day, and giving your body a chance to come back to life from the inside out. Days 8 to 14, protein rebuilding, restoring your nails and your brain cells. Nails are made of keratin and protein. Your brain is nourished by amino acids, the building blocks of protein. When your body is low on protein, your nails grow slowly and weakly, and your brain grows slow and tired. I remember Caroline, 75 years old, who always ate very little because she didn't want to overeat. Her nails were as thin as paper, and her memory had clearly declined. After we steadily increased her protein intake for 2 months with eggs, fish, Greek yogurt, her nails grew faster and stronger, and her memory stabilized. So in this second week, ask yourself, does my meal truly nourish me, or does it just fill me up? Days 15 to 21, anti-inflammation shift, reducing inflammation to clear the path for blood to the brain. Week 3 is the turning point. This is when you help your body lower inflammation, the silent enemy of blood vessels and nails. You can start gently. Swap chips for walnuts. Swap a fatty steak for salmon. Add dark leafy greens to dinner. Cut back on sugar and processed foods. I often tell my patients, if you can't pronounce the name of the ingredients on the label, it's probably better not to eat it. One small change, but it creates a new current in your body, in your nails, and in your mind. Days 22-30. Circulation training. Bringing blood back to the places it has forgotten. You don't need to run marathons. You don't need a gym. You just need to move. A little, every day. In this final week, I suggest a simple but powerful routine. I call it the nail-to-brain flow routine. Just 8 minutes a day. Massage around your nails. 1 minute. Open and close your hands quickly. 30 seconds. Walk slowly. 4 minutes. Deep inhale. Long exhale. 2 minutes. That's it. But nail growth often changes noticeably within a few weeks, and many patients tell me their mind feels clearer. This routine doesn't just strengthen the vessels in your hands. It also encourages better blood flow to the brain. Do you believe that in just 30 days, you could change the way your body functions? Do you believe that a small change in your nails could reflect a much bigger change in your brain, your heart, and your vessels? I've seen it happen hundreds of times. And every time, I'm reminded of something beautiful about the human body. We are never too old to heal. We only have to begin. A small lesson from this 30-day journey. When you take care of your nails, you are really taking care of your blood vessels, your breath, and your brain, the place that holds your memory, your clarity, and the story of your life. This is not just a 30-day plan. It's an invitation to become friends with your own body again. And once you begin listening, you'll notice something else. Not every nail change is dangerous, but not every nail change is harmless either. In the next part, we'll explore the most common misunderstandings Americans have about their nails and why those misunderstandings cause so many people to miss their golden opportunity to prevent a stroke. Let's keep going. What weighed on my mind the most after 4 decades in medicine is this. It's not that Americans lack information. It's that we misinterpret the signals our bodies send us. And the nails, those small, humble structures at the tips of our fingers, are where I see the most misunderstanding. Often, the danger doesn't lie in the change itself, but in the way we explain it away. One spring afternoon, Evelyn, 70 years old, came to see me, looking a little embarrassed. She raised her hands and said, "Dr. Ethan, I think I have nail fungus. My grandkids say so too." I looked at her hands and saw something else entirely. It wasn't fungus. It was severe anemia and poor circulation, making her nails ghostly white and slightly separated from the nail bed. If she had just kept putting antifungal cream on her nails, the real problems inside her body would have kept progressing quietly, possibly toward heart failure or a stroke. And that's what I want to tell you today. Not every nail change is what you think it is. Misconception. Nail changed color. It must be fungus. Many people see their nails become chalky white, cloudy, gray, pale yellow, and immediately think fungus. But in most of the cases, I I see those changes come instead from anemia, vascular inflammation, low oxygen, or reduced blood flow to the fingertips. Fungus usually makes the nail thick, crumbly, distorted, strange colors. On the other hand, often belong to circulation, not infection. Think about it. How many times have you explained something abnormal in your body with the simplest, most convenient answer and ignored the deeper cause? Misconception 2. Weak nails mean I need more calcium. I've heard this line probably thousands of times. But the truth is, calcium has very little to do with nail quality. What usually makes nails weak is low protein, low iron, low zinc, insufficient blood supply to the nail, or chronic inflammation. One of my patients, Harold 72, took calcium for 3 years because he thought his brittle nails were from osteoporosis. But when we tested him, he wasn't lacking calcium at all. He was lacking protein, and he had chronic circulatory insufficiency. Harold looked at me and laughed. I took pills for 3 years and never realized my nails needed blood more than calcium. Sometimes we treat the thing that doesn't need treatment and ignore the thing that's been crying for help for years. Misconception 3. Vertical ridges are just normal aging. Aging can bring many things, but deep nail ridges usually aren't just age. Yes, age can cause faint, shallow, barely noticeable lines, but deep, long, sharp ridges are almost always connected to chronic inflammation, metabolic disease, unstable circulation, prolonged stress, nutritional deficiency. It's not age that carves those lines. It's lifestyle and blood vessels that are tired and overworked that carve them into your nails. Misconception 4. Nails lifting off the bed. Must be chemicals. Yes, chemicals can irritate the nail, but when nails start lifting gradually across several fingers, I always think about low thyroid function, weak circulation, anemia, or long-term oxygen problems. Like I mentioned with Janet earlier, she didn't use chemicals, didn't wear nail polish, and her nails still lifted because the cause was inside, not outside. You see, we love to blame the things that touch us, the soap, the polish, the cleaner, and we forget that sometimes the problem comes from a body that's quietly exhausted. Has there ever been a time in your life when you misread a sign in your body, in a relationship, or in your own heart, just because it looked like something simple? And if you had stopped for a moment, looked a little closer, you might have discovered something completely different underneath. The body is just like a person. It never sends meaningless signals. We're simply the ones that interpret them incorrectly. A small lesson from all the misdiagnoses. When we misunderstand, we act wrongly. But when we understand correctly, we can save ourselves. What matters is not just what you see on your nails, but what you understand it to mean. And once you see it clearly, you realize your body has been trying to tell you the truth all along. Now that we understand what nails are trying to warn us about, and which misunderstandings cause us to miss those warnings, the most important question becomes, when do these signs become a true red light? When do we need to act immediately? In the next part, we'll talk about the absolutely critical signs, and when they appear, you should not delay even a minute. Let's move on. Up to now, we've talked about the gentle signs, the subtle changes in the nails that the body uses to whisper to you. But there are moments when the body doesn't whisper anymore. It knocks louder. And finally, if we still don't respond, it cries out for help. Today, I want to talk to you about the moments we're not allowed to ignore. I remember a patient named Samuel, 67 years old. He was tough, the kind of man who always believed he could handle it. One day, he noticed a dark, thick line running from the base to the tip of his nail. He thought it was just a bruise, nothing serious. But when that line didn't fade after several weeks, his wife insisted he come see me. It turned out to be a sign of microclots. Tiny blood clots traveling through his body, any one of which could have reached his brain at any time. Samuel looked at me, eyes wide. I didn't think it was that serious. It was just a small line. Sometimes, the smallest marks carry the loudest messages. Red flag 1. A sudden black streak that doesn't fade. A dark line running along the nail appearing without clear injury. It's never something to ignore. It can be microclots, vasculitis vessel inflammation, clotting disorders, or even early melanoma rare, but not something to dismiss. If you see one black line on one nail, get it checked. If you see multiple lines on several nails, get it checked immediately. That's the voice of your circulatory system, and sometimes the voice of survival itself. Red flag 2. Nails suddenly curving downward, clubbing. If previously normal nails begin to curve downward clearly, swell at the fingertips, look unusually shiny, that can be a sign of chronic low oxygen. This pattern is often linked to decompensated heart disease, respiratory failure, pulmonary fibrosis, or serious circulatory issues. I once saw a patient named Charles who had never felt short of breath in his life, but his nails started curving rapidly over just a few months. When we examined him, we discovered pulmonary artery narrowing, a condition he'd never even heard of before, and thanks to his nails, we caught it early. Red flag 3. Nails separating from the nail bed across several nails. One nail lifting can be from trauma, but when multiple nails are lifting at the same time, that is never normal. It can signal thyroid disorders, bloodstream infections, severe peripheral circulation problems, profound anemia, systemic inflammatory reactions. I remember Lucille, 74 years old. Her nails started detaching slowly. No pain, no redness. She thought she just needed more vitamins. But when we ran tests, she had endocarditis, a very dangerous infection of the heart lining. If she hadn't come in early, the outcome could have been very different. Red flag 4. Sudden color change, especially blue-purple or chalk white. If your nails suddenly turn purple, turn blue, become porcelain white, or go oddly gray, and they don't improve after warming up for a few minutes, that's a sign blood isn't reaching your fingertips properly. And if blood isn't reaching your fingertips, ask yourself, is it really reaching my brain the way it should? This is a sign that calls for urgent evaluation, because it can indicate blocked vessels, severe low oxygen, heart failure, or a pre-stroke state. One small question that might save your life. Are you waiting for a more serious sign before you get checked? Are you waiting for your body to scream? While it has already been knocking on your door for months, through small changes in your nails. I've seen far too many people who believed it will go away on its own. But the body is not like a scratch on the skin. When your nails change shape, there is always a reason. The question is not, do they look pretty? The question is, what are they trying to say? If you act early, you win. That's what I always tell my patients. No one has ever regretted getting checked too soon, but I've seen many regret waiting too long. Nails are the farthest point from your heart, so when they change shape, treat that as your final warning. And now, as we've walked through this 10-part journey, from the tiniest, softest signs to the most dangerous red flags, there is one message I want to leave with you. You can change your health simply by paying attention to the things most people ignore. As we close our time together today, I want you to remember a very simple truth. Your nails are the only part of your body that visibly reflects your circulation, oxygen level, and inflammatory state in real time. They are your early warning system, signals quietly flashing long before danger reaches your heart or your brain. So please, don't wait. Don't wait until numbness appears, or dizziness, or the morning you wake up and your words don't come out right. Don't wait until a stroke speaks for you. After your nails have been trying to speak to you for months, you deserve to recognize early signs. You deserve a body that feels strong, stable, and safe. If today you feel you understand your body even a little better, I hope you'll keep walking this path with me. I create these lessons to help you understand yourself calmly, clearly, and with enough strength to act before it's too late. Take a moment now to look down at your head and listen to what they might be trying to tell you. And if you'd like to receive more conversations like this, I invite you to subscribe, join this community, and keep learning how to protect your health, starting with the smallest things. Every day, your body is always speaking. Let's learn, together, how to finally listen.